Right now, in medicine cabinets all over the country, there are bottles that people trust completely simply because the label says natural or vitamin. Nobody questions them. Nobody reads the fine print. And that trust is exactly the problem. Here's a number that surprises most people. Every year, doctors see a steady stream of kidney and liver injury cases that trace back not to alcohol, not to prescription drugs, but to over-the-counter supplements. The kind sitting in your kitchen cabinet right now. Today I'm going to walk you through 6 of the most commonly used vitamins and supplements among people over 60. Every one of them has a legitimate, sometimes important use, and every one of them, taken the wrong way, in the wrong amount, or for the wrong reason, has been linked to measurable strain on the kidneys or the liver. Stay to the end, because the 6th one is something almost every health-conscious household has in the cupboard right now, and almost nobody realizes it carries any risk at all. Before we get into the list, I want to be upfront about something. I'm not a pharmacist trying to scare you off supplements altogether. Many of them are genuinely useful. This video exists because there's a real gap between what nutrition labels tell you and what your kidneys and liver actually experience when a supplement is taken daily, for months or years, especially alongside prescription medications, which is extremely common after 60. Everything in this video is based on well-established physiology, how your liver processes compounds, how your kidneys filter and concentrate what you excrete, and what happens when either organ is asked to handle more than it's built for. None of this is exotic, it's basic organ function, explained clearly. One important note before we continue. This video is educational, not medical advice. If you take any of the supplements I'm about to mention, please don't stop cold or make changes without talking to your doctor first, especially if you have existing kidney or liver conditions. What I want to give you is the awareness to ask better questions at your next appointment. Here's the one concept that ties everything in this video together. Your liver and kidneys don't treat a substance differently because it came from a plant, a pharmacy, or a vitamin aisle. They treat it differently based on chemistry and dose. Your liver's job is to break down and neutralize compounds so your body can use or eliminate them. Your kidney's job is to filter your blood and concentrate waste products into urine. Both organs have a working capacity, a ceiling. Prescription drugs are dosed carefully with that ceiling in mind. Supplements, by contrast, are lightly regulated. There's often no doctor checking your blood work before you start one, and no follow-up to see how your body is handling it months later. That gap, no oversight, combined with daily long-term use, is exactly where problems quietly build. Let's go through the 6. Vitamin D deficiency is common after 60, so doctors do often recommend supplementation. This one is legitimate and useful at proper doses. The issue is what's happened in the supplement aisle. It's now common to find over-the-counter D3 pills at 5,000 or even 10,000 IU sold without any blood test to confirm you need that much. Vitamin D is fat-soluble, which means your body stores it rather than flushing out the excess the way it does with water-soluble vitamins like vitamin C. Taken consistently at high doses over months, that stored vitamin D raises calcium absorption from your gut. The result is a condition called hypercalcemia, too much calcium circulating in your blood. Your kidneys are the ones that have to deal with that excess calcium, and over time it can lead to calcium deposits inside kidney tissue, reduced kidney function, and in some documented cases, kidney stones. What to do instead? Get a blood test before starting high-dose vitamin D, and get your levels rechecked periodically if you're taking it long-term. A standard multivitamin dose is very different from a therapeutic megadose, and only one of those should be self-prescribed. This one surprises people because calcium is marketed almost entirely around bone health, and that reputation isn't wrong. Calcium matters for bone density, but there's a difference between calcium from food, which arrives gradually and in smaller amounts throughout the day, and a concentrated calcium supplement taken once or twice a day. When you take a concentrated dose, your blood calcium spikes higher than it would from food alone. Some of that calcium doesn't get absorbed into bone. Instead, it circulates and can end up depositing in soft tissue, including, notably, in the small blood vessels of the kidneys and in arterial walls. Several observational studies over the past decade have raised questions about a link between long-term, high-dose calcium supplementation and increased cardiovascular calcification, which is a related but separate concern worth knowing about. The kidney-specific issue is more direct. Excess unabsorbed calcium is filtered by the kidneys, and in people already prone to kidney stones, concentrated calcium supplements are a well-known contributing factor. What to do instead? Prioritize calcium from food sources, dairy, leafy greens, almonds, where absorption is naturally gradual. If a supplement is medically necessary, ask about pairing it with vitamin K2, which helps direct calcium toward bone rather than soft tissue, and confirm the dose with your doctor rather than the bottle's suggested serving. Iron supplements are often reached for at the first sign of tiredness, low energy, or pale skin, all of which can have a dozen causes that have nothing to do with iron. The trouble is, unlike most vitamins, your body has no efficient way to get rid of excess iron. Once it's absorbed, it stays. Iron that isn't needed for red blood cells gets stored in your organs, particularly the liver. Over months and years of unnecessary supplementation, that iron can accumulate to levels that trigger oxidative stress inside liver cells, essentially chemical damage at the cellular level. This is the same underlying mechanism seen in a genetic condition called hemochromatosis, where the body absorbs too much iron. Taking iron supplements you don't need can produce a milder version of that same burden artificially. This is especially relevant for men over 60 and postmenopausal women, both of whom have naturally lower iron needs than younger menstruating women, yet are sometimes sold the same generic iron supplement. What to do instead? Don't start iron supplementation based on symptoms alone. A simple blood test, ferritin and hemoglobin, tells you definitively whether you're actually deficient. If you're not, skip it entirely. If this is useful to you so far, this is exactly the kind of practical, no-hype health breakdown this channel focuses on. Plain explanations of the science behind everyday health decisions, without trying to sell you anything. If that's helpful, subscribing means you won't miss the next one. Now let's get into supplement number 4, which is one of the most over-supplemented vitamins in the country. Vitamin A supports vision, immune function, and skin health, and it's genuinely important. The problem is stacking. Many people take a daily multivitamin that already contains a full day's worth of vitamin A, and then add a separate vision or skin supplement on top without realizing both contain the same nutrient. Like vitamin D, vitamin A is fat-soluble, so it's stored rather than excreted. Chronic excess intake, not a single high dose, but a daily surplus sustained over years, has been associated in medical literature with liver toxicity. Early signs are often subtle: fatigue, mild abdominal discomfort, or slightly elevated liver enzymes on routine blood work that get written off as unrelated. What to do instead? Check the vitamin A content across every supplement you take, not just one bottle. If you take a multivitamin and a separate eye or skin supplement, add up the total retinol content and compare it to the recommended daily allowance, rather than assuming each bottle is independently safe. Niacin has a well-known, legitimate medical use. At prescription strength doses, it can help manage cholesterol. That legitimate use is exactly why it's confusing that over-the-counter niacin is sold at similar doses without the blood work monitoring that comes with a prescription. At high doses, generally above what you'd get from food or a standard multivitamin, niacin has documented liver effects, including elevated liver enzymes and, in some case reports, more serious liver injury with prolonged use. This risk is well established enough that doctors who prescribe high-dose niacin for cholesterol typically order periodic liver function tests specifically because of it. What to do instead? If you're taking niacin at anything beyond a basic multivitamin dose, that's a conversation to have with your doctor, including periodic liver enzyme testing, the same monitoring a prescription would come with. This is the one I said would surprise you because it's marketed with the exact opposite promise. Supplements sold specifically as liver support, detox blends, or cleanses, often containing concentrated extracts like high-dose green tea extract, kava, or certain herbal combinations. Concentrated herbal extracts are chemically potent in a way that eating the whole food is not. A supplement capsule can contain the concentrated equivalent of dozens of cups of green tea in a single dose, for example. Your liver has to process these concentrated plant compounds just like any other substance, and several specific extracts have documented case reports of liver injury when taken at supplement concentrations over weeks or months, ironically while being marketed as protective for that very organ. What to do instead? Be skeptical of any supplement marketed with the word detox or cleanse. Your liver and kidneys already do that job continuously and don't require concentrated herbal assistance to function. If you want to support liver health, the most evidence-backed approaches remain moderating alcohol, maintaining a healthy weight, and eating a balanced diet, not a capsule. Let's bring it together. 6 supplements, 2 organs, 1 theme. Dose and duration matter more than whether something is labeled natural. 1. High-dose vitamin D. 3. Can raise blood calcium and strain kidneys over time. 2. Calcium supplements alone. Unabsorbed calcium can be filtered into kidney tissue. 3. Unnecessary iron supplements accumulate in the liver with no natural way out. 4. Stacked vitamin A. Chronic excess from multiple sources can stress the liver. 5. High-dose niacin. Same liver risk as the prescription version without the monitoring. 6. Concentrated detox herbal blends. Potent plant extracts your liver still has to process. None of this means supplements are bad. It means dose, duration, and monitoring matter, the same way they would with any medication. I'd like to know, which of these 6 surprised you the most? Was it the calcium, since it's marketed purely around bone health? Was it iron, something many people take without ever getting tested? Or was it the detox supplements, marketed as protective for the very organ they can strain? Let me know in the comments, and if there's a specific supplement you take regularly that you'd like me to break down in a future video, tell me that too. If you know someone who takes a daily handful of supplements without ever having had blood work to check how their body is handling them, a parent, a neighbor, a friend, consider sending them this video. Not to alarm them, just to give them the same information you now have so they can ask better questions at their next doctor's visit. A final note. This video is for educational purposes only and is not medical advice, diagnosis, or treatment. Supplement needs vary significantly from person to person, especially based on existing health conditions and other medications. Please talk to your doctor or pharmacist before starting, stopping, or changing any supplement, particularly if you have any history of kidney or liver concerns. Thanks for watching, and I'll see you in the next one.